All right, I think we are live. Right, so this is Stephanie with Big Dog Mom. I hope everybody's doing awesome today. I'm gonna wait just a second or two to let a few people hop on before we get started. And then I'm also going to quick share this video if I can with the Big Dog Mom community. So let me do that really quick and we will get started. Alrighty. I think I did that right. All right. So, as I said, this is Stephanie with Big Dog Mom. We've got some exciting stuff to cover today. For anybody who is on, if you could let me know whether you can hear me okay. I am using a separate mic that is over here, and I'm not exactly sure. So those of you that just popped on, if you could just let me know that you can hear me and that there's not like a huge echo. I can bring the mic a little bit closer to me, but if you can hear me okay, I may just leave it. So if you could let me know that, that would be terrific. And apologize ahead of time. So this is a little different background than what I've done in the past. So this is our front. Okay, awesome, Allison. Thank you so much. So this is our front room, and this is usually where the dogs bark at people walking by. But I shut the shade, so I'm praying that we won't get this the whole time. So, hey, Junior, look, June. Yes, I got food. Okay, so let's get started. All right, so we've got a few more people hopping on. Oh boy, I shouldn't have got the treats out. Sit. Just wait. Shh, wait. Okay, so what we are going to be talking about today is Wobbler Syndrome. So not the most happy, hey Debbie, happy of topics, but it's a very important one for those of us who are large or giant breed dog owners. Because Wobbler Syndrome is something that is very specific to to big dogs. So I wrote a post, so a couple of housekeeping items here as we get started. I wrote a post about, well, I've written two posts now. So the first one being kind of a more personal story about when Junior was diagnosed with Wobbler Syndrome. And so if you haven't read that, there are links in the post I published last night to that, and I'll include that in the description as well. But then the post that I wrote last night was really more of, kind of laying out the facts about what Wobbler Syndrome is and which breeds are most at risk. And I think the most important thing is around the, how you would diagnose Wobbler Syndrome and treat it. And I would say even more important than all of that would be how can we prevent it, if at all. So I'm going to cover very briefly just what I covered in that post, but I would encourage you, if you haven't done so already, to click. There's two links in the description of this live. Hey, Krista. And so those two links are basically the, you can't see anything. Is it me? So maybe refresh, Krista. And if anybody else isn't able to see me, please let me know. Hopefully I'm not talking to myself. But basically there are two links. So the first one being the link to the post, which I would encourage you to read for sure. And because that is going to give a ton more information than what I'm going to do here today. And then the second link is to my do's and don'ts guide for big dog owners. And this is something that's a pretty comprehensive guide, so it's not just about health and wellness, it's lots of other stuff. But I thought it would be a good freebie to offer with this Facebook Live in the sense that I do talk about getting insurance, which I wish I had, and some other things, feeding and other issues that would be, and tips that would be specific to large and giant breed dog owners. So all of that said, so let's get started. So the first, can you hear Krista? Let me just double check that. I can see and hear just fine. All right, thank you, Debbie. So yeah, maybe just refresh, Krista. Sorry about that. And the lighting is not perfect in this room, so apologize ahead of time. I prefer upstairs where it's a little bit lighter, but I'm praying this will work because I've got carpet here. And so what I'm going to demo here in just a minute, hey, June, good night, it'll be easier in this room. So hopefully we'll get there. So let me just cover Junior. This is maybe a bad idea. Junior, come. Junior. Junior. Hey, come on. Just sit here. Oh, okay. So let's get started. So what is Wobbler syndrome? There are lots of terms that we use. There are lots of terms that we use to describe what Wobbler syndrome is. So it can be, there's a bunch of terms that are used sort of interchangeably. So I'm going to read out what Junior's diagnosis is based on our MRI and x-rays that we had done in July. And so I'm going to read that and then kind of define what that means, okay? So here's what his report and his official diagnosis says. Wobbler syndrome, caudal cervical spondylomyelopathy, cervical vertebral malformation malarticulation. And then it goes on to say osseous proliferation of C4-5 and C5-6 articular facets, as well as hypertrophy of soft tissues / joint capsule with secondary mild vertebral canal stenosis at these locations, predominantly right-sided. Okay, so what does this mean? And this diagnosis is very typical of the Mastiff breed, in the sense that if I had a Doberman here, we would probably be talking about a little different diagnosis. So what this means is that cervical spondylomyelopathy is the name that is most generally used for Wobbler syndrome. And that just means that there is impingement on the spinal cord. And in Junior's case, it's bone proliferation or osseous proliferation, meaning the bone is growing too fast, and it is, so imagine this is your spinal cord right here. The bone is growing too fast on the outside, and it is impinging on the spinal cord, which is causing, in his case, neck pain. And in lots of other cases, the most common sign is going to be a wobbly gait, and we'll talk about that. So that is that's the way it's described, and most often those are the terms that are used. There are two types of wobblers, which I mentioned. So the type that Junior has, which is kind of the bone proliferation that is impinging on the spinal cord and causing that spinal cord compression. And so that's one type that is typically seen, or the most prevalence would be in Mastiffs and Great Danes, and it is usually diagnosed young, so between 6 months to about 3 years, usually younger than 3 years. And Junior was 21 months old when he was diagnosed, so he sort of fits the classic diagnoses of Wobbler syndrome in a Mastiff. So the second type of Wobbler syndrome would be what's considered a disc-associated, and that just means that there is a disc. Hey, awesome, Krista. So that just means that there are, the disc is kind of the source of the problem that is causing compression on the spinal cord. And that is really, that's seen in Dobermans, Dalmatians, and Labradors would be the other breeds, most common in Dobermans. And in fact, it's over, I can't remember the exact statistic, it's about 5% of Dobermans that actually have a disc-associated Wobbler syndrome. And in those breeds, so the Dobermans, Labs, and Dalmatians, and other breeds, so it's not isolated to those, but those are the most prevalent. That is usually diagnosed later in life, so the average age is about 6. So you see a little difference in the disease, but essentially the classic symptom that is consistent among all of these, the two types of Wobbler syndrome and the breeds that would be affected, is the wobbly gait. And so that, it is really classic Wobblers, and it's usually in the hind end at first, the hind legs, and then it as the disease progresses, it ends up affecting the front limbs too. And not in all dogs, and that progression varies by dog, but usually it's a pretty slow progression, but it can be fast in some dogs. So there's a lot of caveats to what I just said. So that wobbly gait, and it looks like unsteadiness. And so there's a difference between what I'm calling the wobbly gait, which would be a sign that it's neurological, which Wobbler syndrome is, versus something that's musculoskeletal. And so if you say your dog is going to the bathroom and you notice that their hind end is weak, that could be wobblers, but it wouldn't be, it could very easily be musculoskeletal as well, a weakness in either the hips or something to that effect. It would be a musculoskeletal issue. So that wobbly gait, kind of an unsteadiness, not being able to really walk on slippery surfaces, losing traction and that sort of thing on slippery surfaces. That's another classic thing. So if you have a dog with Wobbler syndrome, you really want to make sure you minimize the number of slippery surfaces the dog is walking on, because it really is hard for them. And then the stride, that's something else that they talk about, and I do see in Junior, is a longer stride in the back, and in the front legs would have more of a choppy, stiff look. So if you see the dog walking, you'll notice as the disease progresses, a choppier front stride versus the longer stride in the back. And that's usually only seen when the dog is walking slowly. So one thing that I noticed with Junior is that his stride is actually beautiful if he's going faster. But it's when he slows down that you really see the hind end kind of swishing side to side. I don't notice anything in the front, but he was just newly diagnosed. So if anybody has questions, I should offer that up. I can see them. So if you guys have questions, please do ask them, and I'll try to just get to them as we're chatting here. I think I pretty much went through, so what the disease is, causes. So let's cover that. And then here in just a second or two, I am going to show you I'm going to talk about 4 different ways that you can test with a little bit of a caveat to that. You can test neurological function in your dog. There's just some simple things that you can do that I learned when I had Junior diagnosed, when we went in for our MRI. These were physical tests that the neurologist did, and I wanted to share those with you because I do think that they are really helpful, and where people have reached out to me about whether or not their dog has Wobbler syndrome, I've offered those up as tips. Try this at home and just see what happens. My biggest disclaimer, and I should have said this in the beginning, is that I am not a vet. I'm not a trainer, and I'm not a vet. I am somebody who has a dog with Wobbler syndrome, and in the course of my personal experience and all of the research that I've done, I have learned a lot about the disease that I really wanted to share with you. So that is it. Don't take anything that I say here or on my blog as medical advice, or that would take the place of you seeing your veterinarian. Please don't do that. It's not smart. But if you do these simple tests and you notice, and don't ignore your own intuition. You know your dog best. And so if you notice something that seems off, seek veterinary medical attention ASAP. Early intervention is key. So with that disclaimer aside, let's go into causes. There are really 2. I talk about this in my post at greater length, but I'll address it here. Genetics is probably I believe it will end up being the cause of wobblers. That is my belief. That is not based on scientific evidence that says this is a genetic marker for Wobbler syndrome. We don't have that yet. There are researchers at Ohio State, my alma mater, that are studying Wobbler syndrome and are doing amazing work in Dobermans and Great Danes. And I am hoping to be on the forefront of helping them do some more research with Mastiffs as well. So, but what they're doing is they are looking for genetic markers. They're looking into all sorts of aspects of the disease and what causes it. Because once we figure out the cause, we will have much more information about how to treat it as well as how to prevent it, which is the most important thing. So genetics would be one. And so that would be, you have a sire and a dam that you breed, and offspring may have Wobbler syndrome. So what we don't know is if that is the case and how that works. So in some diseases, it skips a generation, or it's a recessive, we just don't know what that looks like for Wobbler syndrome. But what we do know is that it's common in certain breeds and in certain families of breeds. So certain pedigrees have more prevalence of Wobbler syndrome. So what is this? What does that mean? So what it means to me is that, number one, if you're buying a puppy, you want to ask about Wobbler syndrome. If you're getting any of these breeds, good night in heaven. Ask, is there a prevalence of Wobbler syndrome in this line anywhere? And if so, then you would want to, make a prudent decision as far as whether or not you get that puppy. So genetics is one. The second thing would be diet. And this one is a frustrating one to me. And if you read my first post about Wobbler syndrome, it is one of those things that I am incredibly frustrated about, because it is used and it is thrown around as a potential cause of Wobbler syndrome. And yet I have not been able to find any evidence of that. I think what people are saying when they say diet can contribute, and that's a better way to say it, that diet can contribute to development of Wobbler syndrome, in the sense that large and giant breed dogs should not be overfed. You have to watch the calcium phosphorus ratio. And so where puppies are raised and they are overfed and fed too much calcium and that sort of thing, and I think I know all of us here on the call know that, that can lead to growth disorders. So Pano being one, OCD is another one, and there are many others. So I think what they are saying is that because this can potentially be, so the bone proliferation growing too fast in Junior's situation or Junior's case, that could potentially, they thought, could have potentially been exacerbated by he was eating a raw diet. So I'm not going to go into all of that. I'm only going to say this, is that if it's true that diet causes wobblers, you would assume that a diet change would make it better. And I have not seen any evidence of that. And I have decided that hey, Chrissy, I have decided that, we had an MRI back in July, and I will be repeating the MRI maybe even more than once to track what I'm doing for him and whether or not it's helping. And so the only way to know that is to get that MRI. And that brings me to the next point, really quick, is about diagnosis. The only way to officially diagnose Wobbler syndrome is with an MRI. So if you go to your vet and they look at all the signs and symptoms that your dog is experiencing, they may do blood tests, and they may do an x-ray. None of those things is a confirmatory diagnosis. Now, MRIs are very expensive, so that is probably the primary reason that many people don't actually get the diagnosis. They stop short of that, and they potentially may treat the dog as though he has wobblers, and they don't really know with 100% certainty. The other thing the MRI does is it gives you pinpoint accuracy as far as what's exactly happening. In my post, I showed images of Junior's MRI. So you could see the spinal cord where it's normal and then where it's being compressed. So those images are really telling. And I think if you haven't seen it already, definitely go check that out in the link in the description. Okay, so let's do this. So I just covered what is wobblers, the cause, diagnosis, and treatment we'll talk about here just really quick. There are two ways to treat it. Basically medical management, which is what I'm doing with Junior. That includes steroids. He's not on a steroid. He's on gabapentin and Truprofen when he needs it. So an anti-inflammatory and then a pain reliever for neurologic pain. And so that would be what gabapentin is. And then, and that's basically it. So I'm medically managing him. I also use a harness. Their dogs are going to go crazy when they see this. Okay, so I use a harness on him. I don't ever use a neck collar on June. And so those are the ways that I treat it. I block the stairs so he doesn't get free reign of the stairs anymore. And then I take him on shorter walks, because one of the things that I notice with him is that as the walk increases in length, he gets lazier and lazier in his hind end. And so I don't strain him too much when it comes to exercise. I pretty much let him free exercise, and he's crazy. So he gets enough exercise. Okay, so let's do this. And I didn't want to go over 30 minutes. So if anybody has questions, definitely let me know. I'm going to cover 4 things right now. And these are simple things that you can do at home to check neurological function. Hello, Sally. In your dog, and do these whether or not it's an interesting thing. So if you suspect wobblers or not. It's an interesting thing for you to know about and to maybe share this information with your other big dog friends as well. So the first one is a visual assessment. So that is what our neurologist did. And that was basically just watching Junior walk to and from where she was standing. So she could watch his gait in the front and she could watch his gait in the back. And so, as I said before, if you see the wobbly from side to side in the hind end, that would be sort of a classic neurological sign. So, in other words, it's not weakness, which would be musculoskeletal, it's wobbliness or unsteadiness. And in Junior's case, it was a longer stride. So I don't know if, let me see if I can get him to, I don't know if you're going to really be able to see this. So we're going to try. You may not get my head, but rather my body here, which is not ideal. But so let me just try this. Hey, Junior. Okay. Oh, this may not work with Sally. Okay. Come here, Junior. Stand. So I don't think I have enough space here to do a full range of motion, especially because I have Sully here. Hey, Salsa, go. Go. So I'm going to try to block Sully. Let's see if that works. Stay. Sully, stay. Okay, let's see how obedient my dog is. Stay. Sully, sit. Good boy. Down. Stay. Okay, let's try this again. Okay, so the visual assessment, hopefully that makes sense. That, I'm just going to leave that one there because I don't have enough space to paste him so you can see, and he's not real bad, so it's going to be hard for you to see. The second assessment is going to be what's called a proprioception is the term that is used, and basically it's a postural reaction assessment. And this is also called knuckling, so a knuckling test. And if you guys have questions, let me know. So I'm going to show you with Junior, and I'm praying this works. I'm going to walk him over here. Come here, Junior. Come. And so basically what you're going to do, come on, come here. What you're going to do, let's see. I'm going to try to get him so you guys can see. Okay, Junior. He doesn't love this cheese, so I should have thought about that. Okay, so when you've got your dog, it's really hard with a dog this size. Come on. Go. With a dog this size, this test is going to be a little hard, so you may actually need help. And so what you're going to do, and I'm only going to show this with maybe 1 foot, stand. And so basically what you're going to do, let's see, I don't think I can see you, Junior. Come here, let's go this way. I want you to see his paws. So let's see. Okay, so this is fine. So basically what you're going to do, while you're holding, you're going to kind of support their hind end just a little bit. And then what you're going to do is lift up their leg and flip their paw. Now he's pushing back, so I got to kind of reach. Hey. So basically you flip, well, he's not cooperating. So basically you flip it upside down, and essentially what the dog should do is flip it right side up immediately. If there's a delay, here, let's try this again. Come here. All right, stay. So if there's a delay, let's see if people can see. If there's a delay in him flipping his foot back up, that's going to show you that there is a slight, delay. And so that would be an indication of potentially neurological damage or a deficit in that area. So that's the first test, so the knuckling test. Didn't work awesome with him, so I hope that that made sense. Can you post the link of the harness after? Yes, Krista, I sure can. I know, Debbie, I really should have brought a couple of options for treats because Sully will eat anything, and Junior's like, I can sense you want me to do something. I am not interested in that cheese. So, all right, we're going to go on to the third one. So the knuckling test that I just covered is basically you have the dog's paw and you flip it upside down using kind of the top part of their foot. You flip it down and they should rest it. If they have neurological damage, they'll rest it and not flip it immediately. So a normal functioning would be flipping it right back over. And so that's that's probably one of the best tests to do, especially in the hind end. And so I've done this with Junior after exercise, and he is slightly, ever so slightly delayed on his right side in the back. But if I do it now, he flips it right over. So he's got full functioning, which is great. So, okay, the third thing that you're gonna do is called the hopping exercise or hopping assessment. And this is, let me just see if I can, just want to make sure I'm seeing all the comments. Okay, so this one is basically not ideal for giant dogs, but it would be great for a large breed dog or, you know, even a smaller dog. But essentially for a large, medium, Debbie, your size dogs, this would be perfect for. And essentially, hey, June, come. Hey, let's go. Up. Here. Oh. Okay, let's go. Come. Oh, come on. Stand up. I was trying to trick you. You knuckle, hey? Up. Come on. Stand up. Okay, so what this knuckling exercise, or what the hopping exercise is, and it's a little hard with a dog that's 240 pounds, but I'm just going to illustrate. So essentially what you're going to do, here, let's point you this way. Okay. So you're basically going to lift up one side and push towards the other. You're going to push towards the side that is on the ground. So if I'm going to do this, I hold him up, and so he should immediately hop as he feels me push. And that's just assessing like his balance. And his reflexes for keeping himself up. And so you would do that in the front with both front legs, and then you would do it again in the rear. And so I would not do this here. So his reflexes are pretty good in his hind end, and like I said, it's probably because, you know, he doesn't really have a delay when it comes to the hopping test, but some dogs do, and dogs with advanced wobblers would usually have a delay where their body kind of swings over their foot and they don't hop right away. Okay, so there was the knuckling and the hopping, and then the last one is the neck range of motion. And this one, really quickly, is can the paw flipping issue be intermittent? Yes, so that's a great question, Krista. So she's asking, so when you do the knuckling exercise, sometimes there would be a delay and maybe sometimes there wouldn't. And I believe, yes, that would absolutely be the case. It could be. I shouldn't say would be. It could be. And in Junior's case, it is. So when he has been exercising, and I think it would also be intermittent in the sense that if there's a lot of inflammation and that sort of thing and there's stuff going on, then yeah, it could be. It could absolutely be intermittent. But with June, it's more of a function of exercise. So yeah, to answer your question, there would be. So the last test, really quick, is going to be it's with respect to the neck. And so, as I said at the beginning, Junior was diagnosed with Wobbler syndrome, and his symptom was neck pain. That was it. So he had a lump on his, kind of in the front of his shoulder, and neck pain right at the same time. And when we finally resolved the lump over 3-4 months, it was crazy. The neck pains, it stayed, and it progressively got worse and worse, where my kids couldn't even walk near him and Junior would yelp. June couldn't turn corners. He was yelping all the time. So every little slight movement, if he would anticipate you bumping him, and he would yelp. He stopped going up and down the stairs voluntarily. So there was lots that went on, but it was all stemming from neck pain. And so, hey, June. Okay, I'm gonna try this with something. Here, we're gonna try this. Hey, June. And so one of the things with Wobbler syndrome that you will often see, and was absolutely classic with June, was hanging his head really low, like not wanting to hold his head up, walk with his head up. He always had his head down. And so that was the position that caused the least amount of pressure to the C4-5 and the C5-6 where his issues were. So, so hanging head low. So one of the things that the neurologist did that was the most eye-opening for Junior when she tested him was getting him to push his nose down to his chest. In the post, I included a link to a gentleman who's, I think, does more like sports medicine with dogs. But I thought his illustration of proper range of motion in a dog's neck was fantastic. And I can't really reproduce that with my dogs. Probably could with Sully, but he's a little crazy. So I don't know that I'm going to try that. But I just want to show you kind of how to do the test and then explain what normal would be and that he's not normal. Okay, so if he really wanted this, so I would basically use something and get his head, his muzzle to kind of touch his chest. And that a normal range of motion for a dog would be that he could bend his head all the way down like that. And with June, he is very stiff in his neck and does, this is about as far as he ever would go. So, and usually when you're doing this test, excuse me, you want to hold the dog pretty steady while you're doing it and then get them to bend their head down. The other kind of classic symptom with Wobbler syndrome is the side to side of the neck. And so that was definitely one of the things that we saw with June, is that it hurt him to go from side to side. So essentially the way you would try to test this is if he actually really wanted this bone, I would kind of hold him steady and then twist his head from side to side and just see how he reacts. And he's doing pretty good that way. And then this, I would do the same thing. And he's doing pretty good. Now, he's also on 900 milligrams of gabapentin twice a day and an anti-inflammatory.
Do you want that? You're all done, my friend. He's a good puppy. He's a good boy.
So he's on pretty hefty pain medication, and so I think if he was off his pain meds for any length of time, I do think he would be much less willing to turn his head from side to side. So that's it. Those are kind of the 4 tests. Are there any questions about that, and was that helpful? If you guys could just let me know that was clear and any questions that you might have, and then we will. Let's see, we are a little over what I wanted. I wanted it to be less than 30 minutes. So let me know if you guys have any questions, and I will just, we can kind of close out for the day. I just really wanted this to be a little more interactive so that if you had questions as it related to what I wrote, that I'm here to answer those. And then, like I said, illustrate those tests as best I can with a 240-pound dog. Awesome. Thank you, Krista. Hey, Ashley. Aren't most Mastiffs supposed to hang their head lower while in gait? Yes. Well, they classically are. So yeah, I think that's a really good point. But his was pronounced. It was an obvious difference between him and Sully when they would walk with a slow gait, just like meandering. Yeah, his head was always low. And so, I mean, even when he would stand, and he would stand all the time too. So that was the other thing where I could tell he's just not comfortable. He's not comfortable laying down. And the way he would lay down, it was in one position. He wouldn't like flop on his side and be like a lazy sitter or a lazy layer the way most Mastiffs are. I mean, Sully can sprawl out. When Junior was in pain, he was stiff and he would hang his head low. And so he would stand in the middle of the room, or at night, he would kind of pace around and he wouldn't lay down. It was heartbreaking. So hopefully that answers your question. And at least in my experience, that's what we saw with respect to the head hanging low. It really was pronounced and not like a class. I know what you're talking about. It wasn't like a classic Mastiff hanging head low, if that makes any sense. Okay, let me just, awesome, Debbie, that's great. So she just said it's very helpful to see how you do the test. Awesome, Chrissy, I'm glad it was helpful. This is a lot of great information. Thanks, Christine, I appreciate it. All right, and Debbie says, I've always had labs and been aware of hip dysplasia as one of the most common health issues. I've never heard of Wobbler syndrome before you bringing it up. So I think overall awareness is important. Yes, 100%. And we had a lab, our Burton, we had for 16 years and got him from a great breeder in Wisconsin. He never had any issues, but Labradors are mentioned as dogs with a higher prevalence of Wobbler syndrome. So, it would be something that I would definitely, if we were looking for another lab, I would ask. I would for sure ask. And since there's no genetic test for it, you would really want to make sure you do your due diligence. And then Krista says, so you have any video or pictures of him prior to medical treatment? I'm sure I do, because I would have sent information, and I'm trying to remember if I have any videos of him. I mean, I could easily take him off pain medication and duplicate what happened. So because all of his issues were neck related, when he's in pain, he does the same thing. So I would hate to put him through that again. But let me look. I think that's a good question. Let me look. And then Bernadette, thank you for hopping on. Thanks for the info. Very interesting and needed info. Awesome. Have you looked into CBD for pain and inflammation? Yes, and he does take CBD. I give that to him once a day in the morning with his meal. And because he's getting so many other things, I don't know, I can't really say with 100% certainty that it is the CBD oil that's keeping him really comfortable. But since he's been on, gabapentin, and I've actually reduced the amount of, so it would be like the generic of Rimadyl, I only give him, I'm supposed to be giving him 300 a day, and I maybe give him 100, maybe. And so not all days. And so I'm doing golden paste, which is the miracle of all miracles for inflammation and pain. So I give him that every day. And so I think that and probably the CBD are two things that are really helping from a natural perspective. And then I was telling Krista the other day, I do a ton of omega-3 fatty acids. So they get 1 or 2 whole sardines that are about this long every day. And then I do fish oil and krill oil. I have a couple of different types. I give phytoplankton on occasion to them as well. So I do a variety of different omega-3 fatty acids, which I also think really helps. And that's good no matter what. Sully gets it too, but I do think it helps with respect to Junior's issues. So yeah, the CBD oil. And then I have links to that too on, I didn't put it in this blog post, but maybe I'll add it back because that's a really good point. I didn't put anything about the omega-3s and some of that stuff that I'm doing on the side to medically manage Junior, but I do feel really strongly that it's important to kind of cover the nutritional side as well. And you can reduce the amount of medications the dog is on by implementing some of these things. I mean, ours eat a raw diet as well, and I do think that helps. So I'm a little biased that way. And then Ashley says, great info, Steph, very informative, awesome. And then I don't know what that was in relation to, Krista. Oh no, but hopefully this was helpful. I won't keep you guys any longer. You can see I have completely bored my dogs. But we got through this okay. Nobody knocked at the door and there wasn't any barking. So at least not here when I was trying to teach. So again, 2 links. So the do's and don'ts guide for big dog owners. I would definitely refer you to that. And I had a bunch of little pop-ups that I totally forgot. So there's one. So that's the do's and don'ts guide. You can download that today. That does subscribe you to my email list, which I hope that you guys that are here hop on there because I do share once a week just little friendly emails. I mean, I'm going to try to do more tips and that sort of thing, but I do let you in a little bit of the behind the scenes of Big Dog Moms. So there's that, the do's and don'ts guide. So bigdogmom.com/do's and don'ts, just spelled out, no apostrophes, of course. And then you can subscribe to Big Dog Mom using that link as well. There are links to the post in the description below. And then I would also encourage, if you want to hear the neurologist that we met with when Junior was getting his diagnosis, I actually filmed that, and that is on YouTube. And so the link to that is in my first post about Wobblers Syndrome. But I'll link that in this video as well, below this video, so that you can watch that. And it is a live discussion using vertebrae and an actual video of his MRI and his x-rays. And she explains exactly what you're looking at. It's phenomenal. So if you haven't seen that and you want more information about Wobbler syndrome and what it looks like, definitely go there as well. So anyway, that's all I have. Thank you so much for those of you that hopped on. I hope this was helpful. And I just wish you guys the best, most amazing, relaxing weekend. And we will chat again soon. All right, bye for now, guys.